Hello everyone and welcome to the AMC preparation course first lecture with the title of Principles of Dermatology. So let's begin. So first of all, what is dermatology? So dermatology is a branch of medicine concerned with the skin, hair and nails, as well as the conditions associated with them. So how can it get diagnosed? Any condition with a dermatology pathology, how can we diagnose it? Like any other disease, first of all, we'll take a patient history, then we'll initiate a physical examination, then we'll send the patient to some certain labs or a biopsy if needed. So let's say that this is our patient. Let's name him Marco, for example. He came to us. We can see visibly that he have rash on his face. So when any patients come to us, we will ask him first of all, what are you complaining of? Why did you come to the hospital today? So first question will be, what are you complaining of? He will tell us, oh, I have a rash on my face, whatever. Then we will naturally ask him, when did this rash appear? Or since how long do you have this rash? So onset and duration. Then we'll learn later on in this lecture or maybe the next lecture the morphology and the type of lesions and rashes, and we will determine what kind of type of rash does he have or lesion. After that, we will ask some symptoms that can come with the rash so we can differentiate a couple of kinds of rashes. So what questions should we ask in this case? So first of all, we will ask him if this rash is painful. This is the first question. Then we will ask him if this rash is itchy. Wait, I'm noting something. One, two, three, four, five, six. He has six fingers, but that's fine. This is a medical condition. So we'll ask him if this rash is itchy, and he'll say yes, no. Then we will ask him if he have any fever, because some rashes come with a fever, just like scarlet fever, for example, or measles. We will have rash and fever. And finally, we will ask him if this rash get any worse when we go to a place with the sun or no, because some rashes are light sensitive. So the symptoms, and we ask all these questions. Then we'll ask some questions about his medical history. So first of all, we'll ask about his past medical history, any diseases he have, any conditions, anything he will tell us. Then we will ask about the drug history. We will ask this question because of two things. First of all, maybe he just started taking a new drug, and this drug is causing hypersensitivity, and we will see urticaria on his body, which is a rash as well. Or he is taking two drugs together that is causing a drug interaction and this cause rash. Then we'll do a review of systems. We'll start system by system and see if you have any problem in any system, because some problem in some systems can cause rashes or the pigmentation of the skin. For example, if you have some renal insufficiency, adrenal insufficiency, I'm sorry. So we will have low cortisol levels, and this will cause Addison disease, and this will cause hyperpigmentation of the palm. Or, for example, maybe if we have diabetes, we will see some insulin resistance signs, black discoloration on his neck or some other places in the body. Then we will ask him about the social history. We focus on two things here. First of all, his working hazard, because we want to know if he is in any contact with any diseases. I'm sorry, with any chemicals. And we will ask if he has some rash on his genital areas. We will ask him about his sexual life. Now, someone will say, hey, you forgot something. Wait, I didn't forget it. So, family history. I put this in one because I wanted to show you this picture. So we have this thing. I hope it's clear in the video. It's like a brown discoloration of the skin. We call it the cafe spot. This is normal in some conditions, like maybe one of the listeners now have it in their body, but sometimes it's a part of inherited disease such as neurofibromatosis. Then we will move to the physical examination. In the physical examination, we will do a general inspection. Then we will do an examination of a couple parts of the body, skin, hair, nails, and we will see them. So we will start one by one. So first of all, the skin. This will include the hands, mouth, scalp, and nails. and we search for any signs of dermatological conditions. So let's say that this is our patient. So he came to us. He said, "Oh, I have some lesions in my body." So first of all, we will do an inspection. We'll tell him, "Hey, sir, where's the lesions?" He'll say, "On my back," and we start inspecting them. Then we'll start palpating them. We will touch them and see their consistency. We'll see if it's solid, if it's smooth, if it's rigid, whatever, and we write them down. Then we will record the lesion characteristics. So what will this contain? So first of all, the location. So here we have it on his back. The number, is it single or multiple? So in our patient, we have 1, 2, 3, 4, 5, 6, 7, maybe 8. So it's multiple. Then the size, we will bring the, what do you call it? The centimeter thing, the meter thing with the centimeters, and we will measure it. We'll take two dimensions, maybe 2 centimeters multiplied by 3 centimeters or whatever. Then we will record its color, the texture, and the shape, round, oval, for example. Then we'll speak about the distribution. We will see if it's symmetric or asymmetric. We will divide it by half and see if the right part is the same as the left part or there's some difference. In case it's on our limbs, we'll see if it's unilateral or bilateral. For example, just think with me. If some patient came to you and he have some rash on his right elbow, let's say, or some psoriatic plague or anything, we'll check the left limb and see if it's there or not. So we see it's bilateral, two limbs, unilateral, one limb. Diffuse or grouped, I have some good pictures for this one, so we'll speak about it in the next slide. And we will see if there's any secondary changes, like for example, scratching marks. If there's scratching marks, we will know that this lesion or rash is itchy. So let's move on and see what are the diffuse or group rashes. So now we see this erythema multiforme. It's diffused in all the skin. It's not just grouped in one place, so it's diffused. If we go to the shingles, it's grouped in one place, as we see. This is a group, this is a group, this is a group, and this is a group. So it's grouped. Now, I'm sorry, I forget to tell you something. We will search also for typical skin signs. So, for the first sign is Nikolsky sign. It's the slowing of the epidermis when lateral pressure is applied on the skin, suggests a detachment of the epidermis from the dermis. So actually, until you see it, you won't get it very well. So I will add a video now by editing, I think, because I can't open it now. I think this will disrupt the recording thing. So please save the video, then I'll speak about it.
If you push on it, you see this is Nikolsky sign, and basically it's a popped blister, and I mean the whole point is the skin wouldn't move here if there's no blister because it's nice and attached. But once you have detachment, either in toxic epidermal necrolysis or in pemphigus vulgaris, you see that the skin moves, and that's the Nikolsky sign that I've just demonstrated.
So you saw the video. He pressed on the normal skin and nothing happened. That's because there's no space between the epidermis and the dermis. While when we have a blister, when you pressed on it, a liquid came out. That means there is a detachment between the dermis and the epidermis, and that's why we have a liquid in between them. So this is the Nikolsky sign. Then we move to the next one, Ociptis sign. Ociptis sign. I think I pronounced it right. So we'll see a bleeding marks in the rash. As we see the red dots or things on the rash, it's bleeding. It's very clear sometimes in the psoriasis. So now, in this case, we have psoriatic scale or plague. We will see this red dots or lines, and this is the Ociptis sign. Actually, this is all for the first lecture. So we'll continue in the second part. We'll talk about some interesting things and we'll continue the physical examination. I hope you found this video helpful and you enjoyed it. Thank you so much for listening. You have a great day. Goodbye.